There's been a change in how local COVID deaths are handled, and this means families may be able to hold funerals and close out their loved ones' affairs sooner. When COVID happened, medical examiners' offices saw an increase in their workload, and some offices had a massive backlog. The Florida Medical Examiners Commission passed this motion 7-1 on Friday that local medical examiners will no longer accept the casework anymore unless it's necessary. News4Jax reporter Janice Harris joining us live at the local medical examiner's office for District 4. It handles deaths in Duval, Nassau, and Clay counties. Janice, you found out that office had an increased workload.
It did have an increased workload, but they do not have a backlog. But that motion made the decision that medical examiners throughout the state, now they will not have to review any of those COVID cases. Instead, they will be reviewed at the hospital.
Representing the Sheriff's Association and Sheriff of Hamilton County.
Some families in Florida have been waiting to bury their loved ones after they died from COVID-19. Florida's Medical Examiners Commission has stepped in to resolve the delay with this motion last Friday that says, quote, Florida medical examiners need not accept jurisdiction of COVID-19 related deaths. Local public defender Charlie Kofer is part of that commission.
What this will really help is the families of people who've died of COVID to get the bodies of their loved ones released quickly for funeral purposes.
The motion was approved 7-1. Local MEO for District 4 has seen a workload increase due to COVID-19 too, but it does not have a backlog. MEO District 4 has handled 483 COVID-19 related cases since March. Miami-Dade's examiner has seen an increase in workload and a backlog, delaying the release of bodies. Miami-Dade reported a backlog of approximately 650 COVID-related deaths to be reviewed. Kofer says this new motion will help decrease workloads for examiners, too.
So the reporting of these deaths will be more timely and more efficiently done. And the medical examiners can then return to doing what they need to do.
Examiners and their staff were doing normal autopsy reviews and COVID-19 cases, but that will stop immediately.
The commission hopes that this will help ease the stress of families. Also, the staff, the workers, and the medical examiners that are in these offices with that workload by taking this responsibility away from them and now having the responsibility placed on the hospitals. Hopefully, this will help everyone with the workflow. Reporting live at the medical examiner's office for District 4, Janice Harris, Channel 4, the local station.